Hi, good evening everybody. My name is Stuart Schlossman. I want to welcome you to another Compass MS Care program. We are doing this event very differently tonight than most nights, okay? Normally we get started around 6:15, 6:30 p.m. Eastern time. Well, for tonight, because this is a Pacific Coast, yes, West Coast of the United States, we wanted to do this a little bit differently. We have our presenters that are speaking from the West Coast. I'll introduce them in a minute. But first, I want to let you know that this is MS Views and News educational program. And again, my name is Stuart Schlossman, president and founder of MS Views and News. And tonight, we are supported by Novartis and Bristol-Myers Squibb. Okay? We are doing this event, like I said, a bit differently. So tonight's guests from the West Coast. Brian Hutchinson is the director of the Multiple Sclerosis Achievement Center in Sacramento, California. The Multiple Sclerosis Achievement Center provides wellness programs for people living with multiple sclerosis through a series of programs to address physical, cognitive, and emotional wellness. As director, Brian oversees the program, the development, staffing, and administration. He's also served as CEO of the Huega Center for Multiple Sclerosis. And for those that don't know, the Huega Center has, for now, 10 plus years, been the Can Do MS Center, and they are a great organization. And thank you, Brian, for all that you do. And we're going to let Brian take it away. Brian's going to talk about, he's going to talk about wellness therapy, cognitive stimulation, benefit of stretching, and using exercise. Okay, Brian? It's all yours.
All right. Thank you, Stuart. Can you hear me okay?
I can hear you perfectly.
Okay, great. Well, I think all of you have been sitting for a little over an hour, so why don't you first, if you can stand up, go ahead and do so if you haven't been doing that. If you can't stand up, I just want you to go ahead and lift your arms up over your head. Just get yourself a little bit stretched out. Maybe turn to the right, turn to the left. All right. Just kind of make sure that you're moving a little bit as we go through our talk a little bit here about exercise. So let's move on to the next slide. And what I want to do is level set a little bit. But I'm going to be using some of these terms, rehabilitation, physical activity, and exercise throughout the presentation. And they often, when I talk to people, they don't know what the difference is. When I go to rehabilitation, they tell me to do these exercises. So what I want to let you know is we're going to talk a little bit about all of these different areas, but rehabilitation really is care that can get you back or keep or improve your abilities for daily life. So that may include exercise, and often does, but it may also include other interventions. It may include looking at adaptive aids of some sort. So there's lots of different other components that go into rehabilitation. As Jean-Mi said, physical activity is really any bodily movement produced by skeletal muscles requiring energy expenditure. So if you think about it in terms of all of the different activities you do throughout the day, those count as physical activity. If you're getting up and going and preparing a meal, you're moving around, you're doing different kinds of activities, or you're going out into the backyard and you're gardening, all of those are considered physical activities. If you're doing the laundry, you're picking it up, you're doing lots of different activities that go along with that. Now, exercise is a subset of physical activity that is planned or structured. So it's a little bit different in the respect that what we're looking at is something that is planned. Again, as Jean-Mi talked about, there's lots of different ways in which we look at how you can do that. Often if you read a lot of the journals and those kinds of things, it tells you this was the specific program that person went through, and it was 20 minutes on a stationary bike or 20 minutes on a treadmill. But we know that there's lots of different ways to break that up, and particularly with MS and someone who is dealing with fatigue, we want to look at ways in which we can stack that particular activity throughout the day to decrease some of the different challenges that may go along with that physical activity. So next slide. Physical activity and exercise have a number of different benefits. We've talked or we've heard a lot, and I'm sure there's past presentations that you can go look at that talk about the health benefits of exercise. And we hear about it not just within the MS community, but also for the general population, decreasing some of those comorbidities that were talked about earlier, high blood pressure, cardiovascular disease, all of those different areas that can be additive in terms of one's overall health. We're going to concentrate primarily on function today, and we're going to talk a little bit about how we incorporate physical activity for that. Symptom management, you see fatigue, spasticity, weakness. We often use physical activity as a means of managing these different symptoms. So we incorporate different types of activities in order to decrease or increase endurance and hopefully decrease fatigue. Other kinds of stretching or range of motion activities can help with spasticity, particularly when combined with medications. And then looking at weakness and strengthening exercises that can help in those areas. And we'll talk a little bit about the different ways in which we do that to make it mostly functional. There have been shown to be many different benefits emotionally from exercise. We're not going to touch upon that quite as much tonight, but there's, again, certainly a lot of evidence that shows decreased levels of depression and anxiety with physical activity and exercise programs. And then cognitive function and immune function. I'm going to spend just a couple of minutes on that because I want to get into the practical aspects of exercise. So next slide. So this is some of the data that has come out regarding cognition and physical activity. So there was a question asked earlier during Zhang-Mi's presentation regarding cognition and lumosity and those kinds of cognitive stimulation activities. Well, part of the answer to that question also can be that exercise can be a treatment and a intervention to help with cognition, because some of the data does show that with improvements in or increases in physical activity, and you'll see in that first bullet, increases in aerobic fitness are associated with cognitive performance. And this is looking at specific tests, some of those of which you may have taken, that ask you to they're either paper pencil tests or other kinds of tests that that measure cognitive function, but it also shows improvements on MRI. And fMRI in this particular slide stands for functional MRI. So asking you to do a specific task while in the MRI machine is what functional MRI essentially looks at. And we can see that there's increased activation that is associated with increases in aerobic fitness. So exercise in and of itself may have an effect on cognitive performance. In a more or a little lower level type of research study, looking at the fact that there's an inverse correlation or an opposite correlation between physical activity and perceived cognitive deficits. So what that means is as physical activity increases, cognitive deficits go down. And as physical activity goes down, cognitive deficits go up. And that's a self-reported type of a measure, is that perceived cognitive deficits. If you look at enough research and enough research is done, you'll see often that there's both sides of the coin. So this particular study looked at yoga and aerobic exercise and didn't show any effects on cognitive function. Other studies have shown aerobic exercise to have improvements in cognitive function, but you have to weigh the pros and the cons and look at many different aspects. So cognition is definitely one of those areas that we are studying more and more as it relates to physical activity interventions. Okay, next slide. The other area that is kind of new and we're looking at from a research component is the immune system, exercise and the effects on the immune system. This particular study, and there's a number of them actually, I just pulled this one out because I think it is one of the ones that has the better design as well as a more realistic type of approach. So they looked at a progressive resistance training program. And you may have heard of this type of program. It's primarily strength training. And they looked at upper and lower body starting with a relatively low load. So you can translate that into most likely a relatively low weight, and then progressing to a higher load. So increasing weight over time. So over that 12 weeks, they started out at a relatively low level, and in this case, it was weight training, and then they progressed up to a higher load and a higher weight. In addition, they added an aerobic exercise program, and in this case, as was mentioned earlier, for research purposes, they did stationary cycling for 20 minutes at a relatively moderate level, which is 60% of aerobic capacity. Most likely, that particular 60% is a level in which you can still maintain a conversation. You might have to start breaking up your sentences a little bit, but by and large, it's a moderate type of exercise. And what they found with that was decreases in fatigue, which doesn't necessarily speak directly to the immune system, but they did show decrease or reductions in pro-inflammatory cytokines, or these circulating cytokines. So these are cytokines that promote inflammation. And they also showed increases in anti-inflammatory cytokines, or those which would tend to dampen down that inflammation. So that would tell us that these are some areas that may have an impact on the immune system and the inflammatory process specifically. They've looked at other types of BDNF is one. They looked at brain-derived neurotrophic factor and have shown improvements in BDNF with exercise and nerve growth factors and others. So this is a newer area of study, particularly as it relates to MS, but an area that I think we will continue to see data come out and show hopefully improvements. And as we can nail it down, we can go from there. Okay, now we're going to take a little trip down memory lane. And talk about some of the exercise programs over time. And what you'll see is there's some similarities as we move through these different decades. But the most popular exercise programs via Google search in the 1950s were jumping jacks. That was in and of itself considered an exercise program, and I'm sure brings us all back to physical education class. And it just kind of takes you back into that particular memory. Another popular exercise program was a combination of calisthenics and resistance training. So typically calisthenics are activities that don't require equipment. So think about push-ups, think about sit-ups, all of those different kinds of things that we think about with calisthenics, as well as some different stretching type exercises. And then there was another specific program called 5 Basic Exercises. And those 5 exercises, as you can see, were touching your toes, abdominal crunches, push-ups, a stationary run, and leg kicks. And all of these were designed to be completed within 11 minutes and was developed by a Canadian Air Force veteran. So these programs were popular in the 1950s. We're going to skip a couple decades, but move forward to the 1990s, and these started to be a little bit more organized types of activities. Step aerobics was one of the more popular exercise programs in the 90s. Taibo, which was a combination of martial arts and kickboxing, and could be done via DVD or tape, and these were different kinds of activities that incorporated different movements that helped incorporate balance as well as strengthening. Buns of Steel also showed up as one of those popular exercise programs in the 1990s. And this was described as Pilates styles exercises. So that's another type of program that was available and very popular in the 1990s. Another one, again, if you think about the boom in gyms during the 1990s, spinning was another area that was very popular, which was stationary cycling on adapted bicycles to music led by an instructor. So this was another popular exercise program. As we move forward to this year, again, from a Google search, these are the areas that we see that show up as popular exercise programs. You may have heard the term HIIT training. This is high intensity interval training, which is really short bursts of high intensity exercise, and then those are balanced by periods of rest or lower intensity exercise. CrossFit is another area which is essentially a type of high intensity interval training, which utilizes functional movements and often kind of various items that can be used that don't necessarily include gym equipment. So tires and other kinds of items that you can use that are resistance. TRX is another one, which primarily uses body weight, but also uses a suspension trainer with the idea of really developing strength, core stability, and balance. P90X is an at-home DVD program that includes exercise as well as nutrition, and one of the most popular right now is Peloton, which again is a lot like spinning in the 90s, but can be done in the comfort of your own home, and you can watch a screen on your bike and follow that particular program. So what you can see is a lot of these things tend to be recycled over time, but a lot of them are very applicable to what you can do at home. And the key to all of them is that they include movement. And that's really what we want to look at, is how can we get people to be more mobile and more active. As we move into what we talk a little bit more from a rehabilitation standpoint, even beyond rehabilitation, what we want to look at is how do we incorporate specificity of training as well as functional exercise training. So when we talk about specificity of training, which is the next slide, we're talking about something that is looking at how we can incorporate the specific aspects or the specific adaptations that we do with a particular activity. So what we're looking at is how these particular activities affect both metabolic, muscular, cardiorespiratory, and neurologic responses. And that can then impact how the muscles fire and how the cardiorespiratory system responds. Those are the most specific to the changes. There's a term that you may see out there, and I just put it up there, specific adaptations to impose demands, or the SAID principle. And what that really means is we're trying to look at ways in which we can impact the body in order to be able to get the result that we want. So really, if you look at that last bullet, it's the way that you train will determine the outcome of your training. So what we want to look at is how we can incorporate activities that are going to accomplish the goals that you set around that specificity. So the next slide talks a little bit more about functional exercise training. And functional exercise training really is looking at ways in which you train your muscles to do everyday activities, and I think importantly, safely and efficiently. What you want to look at is how you incorporate your exercises to have a specific purpose. So that purpose may be just to improve your overall endurance. So if you want to improve your overall endurance, you need to look at how you incorporate your program to do so. If you want to be able to improve a functional activity, and we're going to talk a little bit more about those and how to break down those activities in order to do so, then you want to be able to focus in on the activities that are going to improve that particular movement, function, or whatever it happens to be. But functional training really focuses on patterns of movement rather than individual muscles. And I'll go through that here momentarily also. Movement in multiple planes also has an emphasis on the balance and the stabilization. So we're not just looking at how we do different activities and train one specific muscle group, but we're looking at how we do specific functional movements. And that often incorporates core strengthening in order to improve our overall balance, because we're having to do those in a very functional fashion. And then specificity of training is also a hallmark of functional exercise training. So then when we combine both of them, it really is how we look at things from a neurological rehabilitation standpoint. So if you've been to a neurologic physical therapist or occupational therapist, they're probably going to talk to you about activities that are going to improve specific functions. They're going to ask you what your functional goals are. In most cases, if you are going to see a physical therapist, there is a reason that you've been referred to that. Maybe your walking has decreased. Maybe you're having more difficulty with your transfers. Maybe there's other things that need to be incorporated. So those are functional outcomes that you want to improve. And then what we want to do is design your exercise programs around those particular outcomes. And then we want to really emphasize what are real life activities. How can we best simulate those activities in order to gain and improve the overall function that you want to gain with that intervention. Which is why often we are very picky about how you go about doing those particular exercise programs, because it's important to incorporate proper movement patterns, because as you'll see momentarily, you are what you practice. So if you practice inefficiently or improperly, then that movement pattern is not going to be reinforced in the proper way. Okay, the next slide. Another term that is an important one to consider is called neuroplasticity. And it was thought not that long ago that we didn't have the ability to change things. We didn't have neuroplasticity as it related to MS, which really encompasses in the strength of synaptic transmissions, or how one's nerve conduction how those transmissions go. The ability to perhaps go around some of those areas, the formation of what novel synapses, reorganization in the brain in order to be able to accomplish a specific movement. And we know now that interventions do, and exercise specifically, can help promote functional restoration by making some of these changes. So the next slide, please. And some of that research has been shown, specifically with MS patients in physical therapy, to have a benefit on neuroplasticity, enhanced synaptic transmission, nervous system remodeling, what is known as axonal sprouting. And this is looked at in MRI results and looking at other areas that improve with physical therapy. In addition, that idea of cognitive function improving with exercise, there's more research now looking at combining exercise and cognitive training in order to promote neuroplasticity. So making it more of a complex function in which you add a cognitive task to your exercise. And the way that that's typically tested is to have you do a cognitive task while you're doing that particular activity, maybe counting backwards, maybe naming specific fruits that start with the letter A while you're doing different activities. Those are how it's measured. There may be other ways in which the cognitive training can occur along with the exercises. But many studies are supporting rehabilitation techniques and neuroplasticity. I realize this slide's probably a little bit fuzzy, and it's not important that you read all of it, but there are some things, and this goes back to what I was just talking about, that go into that neuroplasticity or that experience-dependent plasticity as it's talked about here. And there's 10 different areas, and I'm not going to go through each one of them, but it's important to know that use it or lose it is one of those principles. So we want to look at ways in which we can identify ways in which we can maintain specific activities. Now you may say, well, you know, I try all the time to be able to lift my toe up and it just won't work. So there are other ways in which we may need to look at it. And it was mentioned functional electrical stimulation or just electrical stimulation may be an intervention that can help maintain some of that function while you're doing a specific activity. The idea that repetition does matter is an important one. But it also is important, as I mentioned, to make sure that that repetition is done in proper and good movement patterns, because if you do it improperly, you're going to reinforce essentially a bad movement pattern. Intensity matters, time matters. All of these different areas are important to incorporate, and that's what we look at when we talk about it from a physical therapy standpoint and an occupational therapy, a rehabilitation standpoint, is how can we incorporate these different things and allow you to be able to do them at home, so we get that repetition, we get that intensity, we get that time in order to be able to get the best result. Okay. So one example of a functional type of activity or a rehabilitation technique is called constraint-induced therapy. This may be something that you've heard of. It's been extensively used in stroke rehabilitation and is something that is being looked at more and more in multiple sclerosis. So the idea is to design a program to overcome learned non-use due to behavioral suppression of a purposeful movement. So this is something that, again, back in the day, we didn't think would be very beneficial. We knew that it was something that was helpful for stroke because it's been around for a lot longer, but we thought with MS, it was not something that was going to be as helpful. So the next slide shows you an example of constraint-induced therapy. You may be able to see that this gentleman has a mitt on his right hand, which is his good hand. So what is happening here is he's being forced to use the hand that is the most effective. And so he's having to feed himself with his left hand, which is the affected hand, and that continue repetition of that movement, and a very purposeful movement of moving a fork to mouth is a very functional type of activity, and we do that repetition, and over time what we see is that we get some of that plasticity and some of that change in function with the ability to use that. So the next slide talks a little bit about some of, I'm sorry, if I go back to the slide previous, the MS looks at, yeah, one more back, please. So you'll see that there have been some small studies in MS, I skipped over that looked at upper extremity and lower extremity and shown benefit with constraint-induced therapy for people with MS. So now you may ask, how does one constrain the lower extremity because you can't put a mitt on it or do whatever that happens to be. So what this is just providing more verbal feedback when the lower extremity is doing what it's supposed to be doing properly, in most cases with gait or other types of activities. So it's a little bit more difficult to study, it's a little bit more difficult to implement, but it is certainly something that is doable. Okay, you can move forward, thank you. So how do you decide what is best for you? Well, I would highly recommend, if you haven't, consulting with a physical or occupational therapist. If you want to get into a more functionally based and specific program towards functional goals. They can work with you on analyzing the activity and then breaking it down into parts. And once that is broken down into parts and it's determined after assessment where some of those challenges lie, you can determine the exercises that would be the most benefit. And then there may be the need to look at adaptations that may be appropriate also, whether it be grab bars or whether it be a raised toilet seat, those kinds of things that may put you at a greater advantage in order to be able to take advantage of the strength that you do have. I would also recommend you take a video of the activity because that can be helpful in bringing it into your therapist in order to be able to identify the different activity and what it is that you would like to gain. So taking a video of the activity is an important way to look at it. And then we look at closed chain versus open chain exercises. Closed chain activities are fixed body segments, whereas open chain are a free body segment. And then we also look at how you incorporate multiple joints and muscles versus isolating a joint and muscle. So now this particular slide shows you that particular activity that you're seeing with that gentleman is he's starting in the number 1 position all the way to the left there and pushing out against weight or against resistance. So ending up in what is labeled number 2. So that's a triceps extension in order to strengthen the back part of your arm. That is an open chain activity because you have a free body segment that is going through that motion. This next one is also for the triceps an open chain exercise. So he's got that weight in his hand and he's extended it up above his head, and then he slowly lowers and bends at the elbow, kind of behind his head. But he's also incorporating some of the closed chain type activities because he's sitting on a ball. So he's open chain for his triceps, but he's making it a very functional movement by sitting on the ball and incorporating some of that balance and stabilization. Then the next one is a push-up. That is an example of a closed chain activity because you have the body segment that is fixed, and that's the hands on the ground. Now this just a fun way of doing that because you've got some weight with his son on his back, and doing a push-up is a closed chain activity. So you're asking the muscles to stabilize around the shoulder joints. You're asking the core to maintain the position throughout the push-up, and then ultimately you are working the muscles in order to go down to the lower push-up position and then push up. So you're working the triceps in all 3 of these activities, but you're working them very differently based on whether it's closed chain or open chain. If we go to the lower extremity, we see this knee extension. So many of you who've been to a gym know that this is a popular machine in which you put your feet behind that pad or 1 foot and extend your knee and lift the weight. So that's an example of an open chain exercise for your quadriceps. The next one shows you a very similar type of activity going from a sitting to a standing position. Also works your quadriceps, but it's also requiring you to work your gluteal muscles. You're working your core muscles, your abdominals, in order to do it properly and come from a sitting to a standing position. You're having to stabilize at your knee and your ankle. So not only are you doing a specific exercise for your quadriceps, but you're also adding in a number of other muscles that are required to accomplish that movement. So we translate it over that way. So now we're going to go through a couple of different activities that may be problematic. It may speak to you, it may not, but you can get a sense of how you can work through this. So getting up from bed from a lying position can be a challenge for people, and it can be a challenge for lots of different reasons. It can be a challenge because you don't have the range of motion in order to get from that lying to the sitting position. It could be a challenge because you don't have the strength to push up from the mattress. And it could be a challenge because the balance, once you do get up, might be challenged. So you do okay getting up to that sitting position, but then you get kind of dizzy, or you get you start to lose your balance because your trunk strength isn't as good. So down below, if we break down that movement, the first thing that you need to be able to do is be able to turn those hips and that trunk in order to be able to get those knees over and to be able to sit up properly. Because if you do a long sit and just kind of go from a lying position to a sitting position, that puts a lot of stress on your back. So we definitely recommend that you roll to the side and then push up from there. So this lumbar rotation that you see below starts to work on that movement. And that may be a place to start if the range of motion is part of the challenge in going from a lying to a sitting position. The next movement is, can you go back, please? The next movement in that is being able to push up with that arm. So you'll see this particular, the middle picture there is the triceps extension. So this is maybe a way in which we can work on strengthening those triceps to be able to straighten your arm to push yourself up to that seated position from the side lying position. And then the last picture that you see there are some weight shifting in a seated chair to work on your trunk muscles, to work on the balance once you get to that sitting position. And these are all types of exercises that may be incorporated depending on where you have some of those deficits with that movement. Next one. All right, so putting on your sock. So this is the way that lots of people have put on their socks traditionally. If you move to the next one, there may be ways in which you want to modify that activity by sitting down, particularly if balance is an issue. You may need to sit down in order to do that. But even if you're sitting down, you can see that having to lift that leg up is an important component in order to get the foot up towards the body and be able to, or towards the hands. So you may need to modify the activity in one situation, but you also, as you'll see in this particular picture, you need that range of motion. So you may need to make sure that you are doing a proper stretching program to maximize the range of motion that you have in your hip extensors. So doing a stretch like this single leg knee to chest might be helpful in allowing you to gain the range of motion that you need in order to accomplish that movement. Then the next picture will show you that you can also work on some standing balance. If you really want to be able to get back to putting your sock on in a way that you used to by standing and putting it on that way, then you can work on some single leg stance and make sure that you're translating that, to the particular activity. So we try to simulate that movement by practicing that single leg stance. And then the next one will show you that you can work on that sitting balance, because not only in that sitting position do you need to have the range of motion, but you have to have the balance in order to be able to lift that leg up and put the sock on, because you're going to be moving with your trunk back and forth. So this is a picture of someone sitting on a therapy ball and moving their feet to be able to tap those particular, that tic-tac-toe board. And that's another way in which you can work on balance, which simulates, to a certain extent, that soft mattress in order to be able to lift that foot up and be able to get that sock on. So breaking down the activity is an important way of doing it. And then lastly, I think it's important to note that there are other options if you don't have that range of motion, and maybe you don't, maybe you can't have that range of motion if you've had other kinds of orthopedic issues and the like. So this is a picture of a sock aid in which you can utilize, kind of wrap that sock around the end of that, and then you put your toes in there and then you pull it up. And that helps you put your sock on. So if there are adaptive pieces of equipment out there that your rehabilitation professionals can help you with. Next. All right, so going upstairs, or as you'll see in the next picture, walking requires a certain amount of that strength that we talked about. In particular, can you go one more? And should just bring up that arrow. In this particular portion of our gait cycle, we have to be able to control that movement of the knee. So some of you out there may have challenges with that portion of your gait in which your knee snaps back or hyperextends, and or you may have that issue going upstairs in which your knee snaps back. So ways in which we might be able to work on that portion of the gait cycle or that portion of strengthening. This gets to specificity of training. So you can see that that particular, where that arrow is pointing, that knee is about 10 degrees or maybe 15 degrees bent. And then as they move over that leg, it becomes straight, but we don't want it to snap back. So we want to be able to control that movement from about 15 degrees to that 0 degrees. One way we can do that is by practicing doing these step-ups, and that maybe will translate over into going upstairs. You can see that gentleman carrying his briefcase and going up the stair, and then the exercise below is a very good simulation of being able to accomplish that activity. So going from that position in which they have their foot on the step and then raising up and controlling the extension of that knee is what we would be looking at doing. The next picture will show you mini squats. So if you're not comfortable being from a balance perspective on one leg, you can still work on those, that control of the extension of your knees by doing these squats. And holding onto the chair provides a bit of balance if you need it, but you're going from that slightly bent position to a straight position. So you're coming up as part of that mini squat. Okay, so this is another common activity, going through and doing laundry. So you're having to pick up the laundry, and she's got very nice form there, not putting a lot of stress on her back, but she has to go from a little bit deeper knee bend in order to be able to pick that up, but also be able to lift the laundry up towards her body so she can keep it close. So we break that down into different movements. It's not only lower extremity, but it's upper extremity, and it's core strength in order to be able to maintain a good posture. So the picture that you'll see next shows you a portion of that movement. This is slightly different than that mini squat. It's going from a seated position to a standing position, or perhaps it's just going even a shorter period, depending on where you may have that weakness. But it's starting at a little bit lower level because we're having to simulate bending down to get that basket. Okay. Then the next one will show you that ability to do kind of a bent over row in order to be able to lift that basket up and keep it close to the body, and then working on the coordination of those two together in order to be able to go from that bending down, picking up that basket, and then lifting it towards your body. Okay, so that's how we can break it down and look at that. So this is kind of a tongue-in-cheek. This is actually a picture of the black hole. But I know that for some people, this is what it looks like at night getting into the bathroom. So you see that night light in there, but that's about all you can see. And you have to get into the bathroom. So what we want to look at is how can we train to a certain extent those systems in order to be able to allow you to be safe. So the next picture shows the first thing is we can work on some balance types of activities when you moving forward and backward to get used to things in an environment that maybe is dark. So you can do that with your eyes closed as long as you have the proper support around you, and you can do it on different types of surfaces. So that allows us to start to train similar to what you are faced with in the middle of the night when it's dark. Next one. And this is another way in which you can look at it. This particular individual is at this point standing in a corner, working on some of that weight shifting. But there, you can see that there's a foam type of platform in front of her. So you can work on those different surfaces and allow you to start to train some of those different areas, both with eyes closed and with eyes open. I would also recommend, and I don't think it's in there, but this is where adaptive equipment comes in also. There's lots of different things you can look at that, the lights turn on when you, motion sensor type lights, those kinds of things to give you a better situation environmentally in order to be able to not have to be walking in the dark. But we want to make sure that we can work with you in the way that you works for you. So exercise examples, we do look at breaking it down typically into 4 different categories. Aerobic or endurance, which is what you often think about: walking, running, bicycling, swimming. All of those things would, if they're regular, continuous, and incorporate large muscle groups, would be considered aerobic exercises. Strengthening, stretching, balance, all of these things are things that you can talk to your therapist or your exercise professional about. And then these combination activities of yoga, Pilates, aquatic exercise, which gives you both endurance, strength, and stretching as part of your overall program. Next. You can adapt your activities. These are different ways in which you can do it. We have here at the Achievement Center, we can work on balance by doing kind of a balloon volleyball type of activity, making sure that it's a safe environment for everyone, but it's something that helps with hand-eye coordination and balance and other kinds of things. We have machines in which we can adapt for people in wheelchairs. You can see some of the fun activities like bowling. You can use the ramps, which still works on standing balance, but doesn't require you to go through all those complex movements. And then the last one is a passive range of motion exercise machine, which moves the legs for you or allows you to work the machine partly while the motor takes over when you get fatigued. Okay, next. These are some other things. This is a tricycle that can be helpful for those who may have balance problems on a regular bicycle. This is a recumbent tricycle that can be helpful. And then lastly, down here is the recumbent elliptical, which is we found to be helpful for a lot of people because it incorporates both arms and legs. And those who just work their legs or just work their arms can become fatigued much quicker. Next. So how do you start? Really, you need to kind of identify, go ahead to the next one. You need to identify what your goals are, where you are in that process. Do you want to make changes to your program? Do you want to start in a different way? And you got to figure out where you are in that process. And this is just a hierarchy that allows you to identify not just exercise changes, but changes in a lot of different ways. So if you're considering something, then you can kind of move on to the next step, which is identify how ready, go ahead, how ready you are for those changes, how willing you are to make those changes, and how confident you are you can make the changes. And then have a conversation with your healthcare professional. And if it's your physician or physician extender and they want to be able to refer you because you think you're ready to make that change, but you need some help, then they can be an advocate and a resource for you. Next. Also, there's been a lot of research that shows individuals who participate in group exercise, there's a greater accountability with that. So, some of those programs that Stuart was talking about, even if online, may provide an opportunity for you to get together with other people and in a group setting can be very helpful as opposed to trying to go through it yourself and gain the motivation to go through your individual exercise. But you need to know how it works for you and what works best for you. Setting goals, setting realistic goals is important in order to be able to move through the process as part of your overall identifying what it is that you want. Do you want to work on functional activities? Knowing your body, and that's particularly around fatigue and heat sensitivity, and then looking at strategies how you can monitor your progress. These days you can use Fitbits or Apple Watches or numerous other things to look at your activity levels, but you can also use an exercise log to be able to go back on and look at how you can best accomplish those activities. So you can go through all of these different things, but exercise, we look at frequency, we look at intensity, and we look at time. We want you to try to incorporate frequency almost every day. in order to be able to form the habit. Plan not to miss more than 2 days consecutively. The intensity, really, if you're starting an exercise program, we use a rate of perceived exertion scale, but in essence, you want to just make sure that you go at whatever works for you. If you're starting out an exercise program, don't worry so much about having to do the no pain, no gain piece. We look at the 2-hour rule, which I'll touch upon here momentarily, and we look at the 10-minute rule. But get started with the activity, see how you do with it, and go from there. And then as far as time and duration when starting an activity, just go as long as you can to start with, and then build up from there. Okay? So practical rules, it's not what you do on one day that counts, it's what you do every day. So consistency is the key here. We want you to get moving, do some activity each and every day if you can, and then you can start to build from there. Form the habit first, and then you can start to go from there. The 2-hour rule is if you don't feel as good 2 hours after you exercise as you did when you started, you did too much. Okay, now you may have just exercised too hard, or you may have exercised too long. That's where the guidance of a physical therapist or exercise professional can be very helpful. And then you start low and you go slow and incorporate a well-rounded program. And if you need help getting started, please seek that out. Okay. And then the next slide really just talks a little bit about most decisions that we make fall into one of these categories, whether it be low risk, high reward, low risk, low reward, high risk, high reward, and high risk, low reward. We know that exercise probably, can you go one more time, falls somewhere in this top tier, and it's somewhere in that low risk, high reward category or low risk, low reward. But we know that it's a low risk. And more data is coming out to show that it may have benefits in the area of immune function. We know that it has benefits from the health perspective. We know that we can improve function through some of these components of neuroplasticity and specificity of training. So these are all low risk for the most part and can be quite high reward. So when you're making your decisions, you can look at which box these fit in. Exercise is in one of these two, but we probably think it leans a little more towards the low risk, high reward. So with that, I will end, and I know I went over.
Thank you very much. Everybody give a round of applause. Yay, round of applause. There we go. Awesome, thank you. All right, so we have a few questions for you. Not too many, but we do have a few. And the first one is from Diane. She's asking about lymphatic drain massage. Could be for the immune system. Is there a good resource to learn how to do it for yourself, or do you have to see a provider?
I'm not familiar with that particular technique, so I would suggest that you're going to have to see a provider. Now, lymphatic drainage that we using the lymph system in order to be able to control edema is again certainly a specialty amongst physical therapy. I've not heard of this particular component as it relates to the brain.
Okay, thank you. What exercises are best to control spasticity?
So the best activities for spasticity management, or as a part of spasticity management, are range of motion and stretching exercises. So we know that if we can combine our stretching with the medications that we take, and if one takes anti-spasticity medications, that we get the greatest benefit because we can get the greatest stretch when those medications are at their peak effect. So looking at stretching exercises can be very helpful, but range of motion particularly continuous types of range of motion have shown to be helpful with spasticity and spasms also. That machine I pointed out that does the passive range of motion, we hear from folks that improves their overall stiffness and spasticity. It is important to note that the spastic muscles, or those that where you have spasticity, are often also weak, even though they tend to be tight. Underneath, from a functional strength standpoint, they tend to be weak. So we want to look at ways in which we can strengthen those muscles also.
Okay, great. So a person writes that they have no restrictions. So therefore, with no restrictions, what are some of the best exercises to do? So
part of that, again, I still think it gets back to what is your functional goal. So does that mean that you want to be able to run a 5K, or do you want to be able to cycle in an event? So then you need to set up your goals and identify which way you want to move forward. If you're just looking for general overall fitness, then what I would suggest is you look at a very well-rounded program. Again, if I go back to that slide that I went through quickly for immune function, or some of the things that we look at, that was a strength training program combined with an aerobic exercise program. So I think that would be a good place to start, and then combining that with some stretching to make sure that you don't incorporate any kind of musculoskeletal injuries would also be, excuse me, an important component to that. So I think a well-rounded program would be the ideal. So, and you can break that up by doing, your endurance 3 days a week, and then some strengthening twice a week. The overall recommendations from the Canadian physical activity guidelines for people with MS talk about looking at about 100 minutes of physical activity and 2 days of strength training.
Okay, thank you. Do you know about any best ways to reduce stress?
Well, I mentioned that physical activity does tend to be a stress reliever in the emotional effects of decreasing anxiety and depression, which aren't always synonymous with stress, but certainly the emotional aspects are well documented with physical activity. So the increased stress that we see, typically the emotional stress, physical activity is a stress also. So one kind of simplistic way to think about it is that we want to be able to replace one form of stress with the other form of stress. So we use the physical stress of exercise to help manage some of the negative stress that we see with whatever situations happen to be going on, like quarantines and so on and so forth.
Just run-of-the-mill things like quarantines, right? Okay, so what are the best wheelchair exercises for building leg strength?
So part of that requires a bit of an assessment, but if you are able to do some standing and do that safely, some of those things I showed, like the mini squats and those kinds of activities, incorporate weight bearing, which is important for bone health, as well as bowel and bladder function. If we can get to an upright position, that helps with everything. So doing those kinds of activities in a closed chain fashion, like squats and other kinds of things, but you really need to be assessed as to where your baseline is in order to be able to determine what is going to be the best and the safest way to do that. Because there's a multitude of exercises using resistance bands, using cuff weights or other kinds of weights that can be very helpful for people who are in wheelchairs. But if we can get you into a functional position and standing is something that you want to do, it all goes back to what your functional goals are, but looking at ways in which you can do it safely and incorporate as many muscle groups as possible.
Is there any way to rebuild atrophied thighs atrophied thighs?
There is. So what we know about strength as it relates to MS is there can be neurologic weakness due to that decreased signal getting to the muscles. We also know that deconditioning is a factor, and Zhang Mi talked a little bit about that and the situation on the question with seeing decreased function, particularly since the stay at home. We need to kind of assess that and determine whether or not deconditioning is a component of it, whether it's neurologic weakness, and can we incorporate some of these aspects of specificity and functional training to implement and utilize that aspect of neuroplasticity to form those novel synapses or that reorganization in order to be able to work with some of that. But mostly what we know is we can affect that deconditioning. So a lot of these things become very circular in that if you have lost some function because of that neurologic weakness, then you do less, so it becomes deconditioned on top of it, and then it becomes very, you want to break that cycle.
Okay, speaking about neuroplasticity, how long does it take to retrain the body?
It's hard to put a very specific time frame on that. We see in many neurologic conditions over a long period of time. We can it often takes a long period of time, or we see the ability for the body to adapt over a long period of time. Most of these studies that we've seen, and when we do see some changes, are anywhere from 10 to 12 weeks, so we can see it as soon as that. But as far as where they are baseline and where we need to go, it really is a very individual situation. So it could take months, but we do know that we can see improvement over time. But most of these studies are probably in about that 12-week frame.
Okay, thank you for that. Is there a stretching routine to assist the body with movement in the morning as opposed to the evening?
There's a number of activities. Part of that depends upon where you're feeling your stiffness or your in the morning versus in the evening. So I think a lot of people describe that they have, their hips are a little bit tight, or they're feeling a little bit tight in their back. So looking at different activities that you can do in the lying position before you get up in the morning can be very helpful. Also, if spasticity is an issue, if there is a way and you are taking medication, if you can take that medication, have it on your bedside table to allow that process to get started, and then do your stretching along with it. We even say if for whatever reason you wake up during the night, if you can take that before you get up in the morning, then you may catch the peak effect of that medicine at night or in the morning after you've taken it, maybe to get up to go to the bathroom or whatever it happens to be. So there aren't any specifics. Again, it really comes down to what your individual situation is. But both the morning when you wake up and the evening before you go to bed are ideal situations in which, if you want to do some of those stretching activities in the lying position, and that's the easiest way for you to do it and the safest way for you to do it, then those are two ideal times to incorporate that program.
So another person writes that they want to know if it's better for them to, is it okay for them to exercise in the afternoon versus the morning, because it seems to take the morning too long to get the body ready to do anything, and in the evenings the body seems to be too fatigued to do anything.
So it is fine. You have to weigh all of those different pros and cons, and you talked a little bit about heat sensitivity earlier, and so if you have heat sensitivity and it's the middle of the afternoon and it tends to be a hotter time of day, that could be more of a challenge, and you may need to plan your exercise around an air-conditioned facility or something along those lines, or use the cooling agents that we talked about earlier. But from a benefit standpoint and a physiologic standpoint, it's not. It doesn't matter whether it's the morning or the afternoon or the evening. What we do say is that you don't want to necessarily exercise right before bedtime. If you can do that a few hours ahead of time, then in many cases that can help with sleep as opposed to impede sleep if you do it right before.
Okay, we only have one more question, and that is that for people who do aquatherapy, at what temperature should the pool water be?
So generally, it's recommended somewhere between 80 and 84. I have a number of people who tell me 84 is way too hot for them. Typically, if you can find a place where they do lap swimming, that is usually a good temperature. So it's generally recommended in that 80 to 84 degree range. But you may need to tweak it based on your situation, and it may depend upon the ambient air temperature at the time, because 80 may not feel quite as good if it's 95 out, and it may feel a lot cooler if it's 85 out. So I think it's important to look at what works best for you. We talked very briefly about how cold affects some people, and we do have situations in which if the water is a bit too cold, people tense up, become a little stiffer. So you have to figure out what works best for you.
Okay. Brian, I want to thank you very much for doing this talk with us this evening, to being here to answer the questions as well. And I hope that we can rely on you in the future to do more events with us. And again, I just wanted to thank you. Is there anything you want to add in from your own standpoint?
Well, the only thing I would add in, I meant to say it at the beginning, you may notice that I have a little bit of scruff here, and I think I'm observing Movember this year, and I think it's important, and it didn't come up, that you make sure that you take care of those primary care needs also. So make sure you get your screenings, make sure you look at all of the different things that are around your overall health in addition to your MS, because as was pointed out, comorbidities and some of these other things that can crop up are certainly things that people with MS are not immune to, and can cause problems also. So make sure that you're taking care of the whole you, and not just isolating and specific to your MS.
We just got a late question being asked that I have to ask, all right? So Diane writes, can you speak more on the balance of activity versus fatigue?
Sure. So this is where the art comes in many cases, as opposed to the science with the activities. But some of this tends to be a bit of trial and error. But what we look at in most cases, if people are having or fatigue is a major symptom for them, is breaking up that activity. So Zhang-Mi mentioned it, looking at physical activity being a component of your overall program. But if you're looking at it specifically from an exercise standpoint, look at how you can break up your exercise throughout the day. So start out by doing 5 minutes in the morning, 5 minutes with each meal, 5 minutes after breakfast, 5 minutes at lunch if you're not intermittent fasting, and then 5 minutes at dinner time. Just time it out throughout the day. See how you feel. Keeping a log or taking note of your symptoms is an important component of that. Then you can start to increase that. And you can go up to 7 minutes and do that 3 times a day. All of a sudden now you're at 20 minutes. And so looking at ways in which you can build it in to your, number one, throughout the day, and number two, to what it is that you do as part of your normal activity. Incorporate some stretching while you're brushing your teeth. You can always do you can stretch your calves. You can do lots of different activities that you can incorporate into your overall function. So looking at ways in which you can incorporate your activity with your dailies, and then breaking it up into smaller chunks is often a good way of helping with fatigue.
Okay, great. Thank you again, and thank you for everything you've done. And I just want to make a couple of announcements, and that is that next week we have Moving with MS. I mentioned it earlier, and that's on the 16th. That's Tuesday, or actually that's on Monday. And then on Tuesday, I am interviewing the Chief of Research for the National Multiple Sclerosis Society, and that is Timothy Coetzee. We are meeting with him, like I said, on Tuesday. And then at the end of the month, we have MS Conversations Now with with different patients, both from the West Coast. So we're doing another Pacific timing program, which makes me very tired. But one is Brittany Quiros from San Diego, Damian Washington from Los Angeles, and I will be doing a conversation with each other about many different things concerning multiple sclerosis, from the West Coast to the East Coast, from their younger audience to my older audience, okay, and just trying to bring it all together and make it something that everybody can learn from. So again, for tonight though, let's give Brian a round of applause again. Thank you for everything, and there are many thanks coming through. So again, thank you to Novartis and Bristol-Myers Squibb, and you all have a great night. Thank you. Bye-bye.